So hi everybody, here we are in Modular 7 or Week 7 about assessment and addictions and trauma diagnosis. Trauma in itself is something that we have come to know in the past years, contemporary years, of how far-reaching it is. It's not just any longer delegated to those who are returning from combat. It is certainly, as we know from the ACEs study and from clients that you work with, that is very far-reaching, and it often happens early in childhood. There could be acute trauma, there can be complex trauma. And there is another course in this curriculum, an elective called Advanced Trauma Practice, that if you're really interested in knowing more about trauma, that I would recommend you take the course, because it goes into great depth about how the brain works or doesn't work, and protective factors and resiliency and post-traumatic growth. But for this modular, we're to focus on how to diagnose, render a diagnosis of PTSD or some other trauma-related diagnosis such as acute stress disorder. What is important with these categories is the time frame of the trauma and how it happens, or when it happens. Again, as social workers, we look to the larger picture, and that is areas of the environment that will either support one's recovery from trauma or foster the continued display of unprocessed traumatic memories. There are a few cases where there's one full case that we're taking a look at in the group discussion, and in the small groups there are, I believe, 2 cases, one of a fireman and one of a woman who has lived at home all her life and is now without either of her parents. And so in all these cases, I would ask that you also take a look at a differential diagnosis, meaning you think it's this one, but it could also be that one, because the criteria can be similar but not exactly specific enough. So you'll get to know that as you get to look more into the categories and the criteria that support the categories of diagnosis. Addictions is another area that we're looking at today, and we do know that addictions comes in many different flavors, as I would say. Those that have mental health issues often will have a comorbid diagnosis of some type of substance abuse or alcohol abuse as a way of self-medicating. We will see this very highly in those that are diagnosed with a trauma diagnosis. So there's plenty of reading to do. Your papers are due by the end of this week. And so if you can get those in, the sooner the better. I know we like to hang on to them to the last moment of the last hour of the week. But it fosters a return if you can get them in when you're comfortable enough to submit them. So have a good week. I'll see you online.